Well, all right, then I see we have two associates online tonight, Dr. Jacoby and Dr. Singh. Last time Dr. Jacoby filled in for the missing Mike Cruz, so we'll, Dr. Singh, we'll ask you to jump in tonight if Mr. Cruz is unable to make the meeting.
Okay, I'll be happy to do that.
Excellent, thank you. So I guess let's call the meeting to order because I see we have a quorum of members present. And Dr. Singh, if Mr. Cruz, please take the place of Mr. Cruz and unless until he shows up. So I'll begin by reading a script which the town of Acton would like us to read at the beginning of every meeting. I'll give you the very short version of it. Good evening. This is a meeting of the Board of Health. It's a regular meeting, and it's being conducted remotely due to the ongoing pandemic and state of emergency in the Commonwealth. Virtual meetings were authorized by order of the governor, and the Board of Selectmen have closed the public facilities as part of the pandemic. So consistent with the governor's order, we're meeting remotely as long as we provide public access, which we do via either a phone-in number or a ability to join the Zoom meeting. And just for your information, the meeting is being recorded. If you wish to speak, we typically allow public comment at the end of board discussion on a particular item. If you wish to speak, please alert the moderator, which is Ms. Ball, that you wish to speak, and likely we'll give you an opportunity to do so. When you're called on to speak, please state your name and where you live. And I think that covers the essential items. So let us begin with the first agenda item, which is, as lately it's been since the start of the pandemic, an update from our health director on new developments, any board required actions, and things for board awareness. So Ms. Ball, over to you.
Okay, good evening, everybody. So I have a few updates today. The first one was we got notification today from the town of Concord indicating that bromate was found in the Lake Nagog, or the reservoir there. They're slightly above the limits. They've taken the reservoir offline, and they won't. They're looking to address. They're looking with the design team to find out what they can do before they bring that water back online, which would potentially be next summer. So I did throw that in extra information in your packet today once I got that notification. So if you didn't have a chance to look, the notification is in there. The remote learning that I promised we would update you on every meeting. I haven't had any new requests for remote learning. We have received permission from the EEC for the Acton Recreation. So right now we just have Teamworks and Acton Recreation that have both been approved. All the inspections have been conducted. So everything's looking good there. I don't think Acton Recreation started yet. They just got the approval on Friday. The other item I want to talk to you about is I've had a request from Hurley's the last name, but she is looking to do a presentation to the board about the health effects of 5G. So I wanted to chat with you guys about that before I let her know that she can schedule that time with you guys. So I wanted to run that by you. And then the last thing I have is hockey. So we unfortunately have seen a bit of a trend with hockey. So it's something that I kind of want to alert you guys because we may have to take action on that if it's the board's wish. I would do so if the board feels it's necessary. And invite any hockey leagues to join us. But we have seen a trend on that, and Heather will probably touch on that a little in her update as well. So that's all I have.
Okay, thank you, Cheryl. So regarding the presentation on 5G, I mean, we're not opposed to hearing from people. Just two questions. Is Ms. Hurley an Acton resident?
She is.
Okay. And so in general, we're usually pretty open to, at least having discussions with residents about things that are health concerns. But I mean, I would alert Ms. Hurley to the fact that, radio transmissions are very strong federal preemption, and it's unlikely that we're going to be able to affect any outcome. I mean, we certainly can be open to it, but um, I hope and if it's an educational thing, that's fine. But there's probably, I would certainly alert her to the fact there's probably very limited action that the board would be able to move forward with, even if we wanted to. Okay, well, with that, then thank you. And it sounds like all the excitement tonight will be in the presentation from our nursing service director, Ms. York. So, Heather, if you wouldn't mind bringing us up to date, please.
Hi, Bill. It's nice to see you all. So currently in Acton, since the beginning of COVID-19, we are at a total of 222 positive cases within the town overall. Currently, we have 6 people in isolation, 195 recovered, and 21 fatalities that were at the beginning of COVID-19 that we are aware of. So I'm sure you all have noticed that the numbers for the state over the last week and a half have really gone up in the amount of daily positive testing. As of last Wednesday, the 14th, Acton was in shaded green with a case count in the last 14 days of 10 positive cases, making the average incidence per 100,000 in the last 14 days 3.0. And then the percentage of positivity over the last 14 days based on the total testing and the tests within the last 14 days was 0.60. So the state is definitely seeing much higher numbers. Today, for the state of Massachusetts, 827 cases were positive, and that is the highest number that I've seen since, May or June. So it is concerning that numbers are still going up. I think, as Cheryl said, there's definitely some concerns and some trends that we're seeing. We have had 3 positive cases in the Acton Boxborough system that were in school at the time, and the school is doing their reporting through the Department of Education on a weekly basis every Thursday for any positive case within the school system, whether it's a student or a teacher or a staff member. So they are doing those updates. Because of those positive cases, there have been a number of contacts that we have had to be in touch with. And there's a lot of questions by parents, of course, which is understandable. But for the most part, it's really gone well. The school is doing a fantastic job doing the contact tracing, having all that information of seating charts, busing charts, lunch charts. They have everyone in their spaces and narrowed down. I think they're definitely being a little more conservative, which is much more conservative than the DESE guidance, which I think is a good idea, especially with the cases going up. As Cheryl said, there are some concerns and definitely a trend that we've been seeing in the last 3 weeks or so regarding hockey. There's a number of private leagues that Acton students are a part of. And we've had a number of contact cases that we've had to do follow up on in the Acton Boxborough system. I know that the Neshoba Board of Health is also dealing with this also. So I think it affects us as a regional school district because there's students in the Acton schools also. So we have a lot of concerns that, or I do at least, that information is not coming to us from the hockey leagues in a timely fashion, letting us know that an Acton resident has become a contact of a positive case from another town. Most of these leagues have multiple towns in their hockey groups. So it goes across multiple boards of health. So I think there's a little bit of a breakdown, and I've reached out to the state over the weekend a couple of times just because this is definitely a concern, I think, as someone doing the contact tracing. So Cheryl and I did just want to bring that to light as a definite trend that we're seeing. Other than that, there hasn't been a lot of changes to the guidance, other than as we're seeing multiple cases, the potential for them at whether it's a place of business, you know, a restaurant, a school, whatever the case may be. If that comes up, what we have to do as a Board of Health is open that with the State Department of Public Health as a cluster. Any cases that are traced back to one location with multiple sites. So that's really what seems to be happening more and more. And that's, I think, part of the reason that I have concerns about these, the contacts that we've been receiving for hockey is these are cluster cases for hockey leagues that there's multiple positive cases that have gone across towns. And then, you know, we're getting late information about these contact cases as a town that we need to monitor these folks. So just a couple of, that's my biggest concern right now. You know, I think people just need to keep vigilant, you know, social distancing, wearing face coverings, because as we've seen over the summer, as things have opened up, the contact tracing gets a little more extensive. Where back in the spring, you know, it was mainly household members or work, if people were working outside of the home. Now we've gone beyond that. Now it's colleges, now it's schools, now it's sports. So it does get to be, you know, quite concerning as the state stays open and people have more contact with other entities outside of Acton. I think that's really it for me. The only other thing, the travel order is still in effect. I just wanted to mention it. You know, the states keep changing as time goes by. I think there's 6 states now or 7 states that are on the low risk, which is not a lot of locations. So there's a lot of testing going on for anyone that's traveling for work and leisure or family of obligations. So I think that's it for me.
All right. Well, thank you, Heather. So I just maybe if I could ask, I heard what you said about the you know, the clusters and also concentrated around hockey, but could you offer suggestions as, I mean, how could the board help? That's what I'm struggling with, because you say it's a communication issue between multiple towns. Is it something where we should try to have some sort of regional meeting of health directors, or do you have something that?
So, I mean, that's definitely a good suggestion. Cheryl and I have talked about this multiple times over the last few days. The problem is, and that we've been seeing, and I know Cheryl has reached out to all the leagues that are based in Acton, that she's given all the information to, and she's done that more than once as the health director. And I've reached out for any of the contact cases. And I did, as I mentioned, spoke to the state about it, which they have sort of pushed my requests or a little bit of a complaint up the line to say, you know, there's some kind of breakdown. I think there needs to be a conversation on the state level that any sports league that, you know, is aware of someone who has tested positive, that those leagues are responsible for reaching out to their local boards of health, because the problem falls into the lag time You know, if as an example, if we found out a week after someone was exposed at a hockey game or a soccer game or whatever the sport is, that's a whole week that potentially the family may not have known, at a certain level, based on the league letting them know that games are canceled and practices are canceled. But there's no outreach on the public health level to call these families to say, this is the quarantine, this is how long you have to be in, and this is what this means. So I think there's a little bit of a breakdown at that level. So doing a Board of Health president or something, there has to be some way to make this a little bit better.
Okay, well, thank you. I mean, I'm just struggling, but I'll ask the other members in just a second here, but for their suggestions, because I'm struggling as to, you know, what concrete steps we could take to make it better.
Oh,
I mean,
sure. I'm struggling also.
okay, because I
Definitely
mean, you know,
struggling.
the
I
hockey
think
rink is.
I think we have to make people aware and parents aware, especially, that yes, if you're notified by your sports league, that's great that they've done that. But there needs to be, you know, you need to make a follow-up call to either the Board of Health or the school nurses to discuss that your child is now on quarantine. And I think that's happening a lot in the school system. You know, we're following up on things as they come in if the kids are contacts of cases outside of school. But there's definitely a breakdown in the sports arena, unfortunately.
Okay, well, thank you. Well, in that case, members, any questions, comments, suggestions to either the report from the health director or the nursing director? Dr. Taylor.
How many contacts have you seen, Heather?
Contacts through the hockey association or in sports in general? Or overall?
Or overall, both.
Overall, in the past, total since the beginning, over 250 contacts, but lately, most positive cases have anywhere from 5 to 12 contacts. So anyone in the last, month that we've been following up on, there's definitely multiple contacts compared to what there has been in the past.
Are they wearing masks when they play hockey?
So Cheryl and I have talked about this, and the guideline and the regulation for hockey is a little vague. It talks about mask wearing is required, but then it talks about if they're putting in extra exertion by skating constantly or consistently, they can take the mask off.
Which would also be that's the time when they're also breathing the heaviest, which means they're most likely to be transmitting virus, I would assume.
Correct. Correct.
So maybe it's something where I just don't understand hockey, well enough. When you say about the number of cases, I assume it's mostly teammates or things like that.
When it gets into a positive case on the hockey level, it's not only teammates, but then it works into families and if these kids have been in school.
Okay.
So it can be quite a large number. And I know that I've talked to multiple Department of Public Health, the local Board of Health level, who are also struggling with this.
So just again, using the example of hockey, I think the guidelines, and I might have this wrong, but I thought a contact was someone that was within 6 feet for more than 10 minutes, something like that. So if you were to check someone in hockey, you'd clearly be within 6 feet, but it would probably be for less than 10 minutes. Is that what they're using, or what you're using as guidance on whether it's a contact?
So what they're using is, it can be how long they're on the ice together. because it's a little difficult for them to determine how many times, let's say someone that tests positive has been in less than 6 feet when there's, as an example, 8 players on the ice.
Okay.
There's
Yeah,
a lot of back and forth.
Right, cumulative time.
Right. Thank you,
Yeah.
Cheryl.
I could see this being very, very difficult. Well, other members, questions, comments? Mr. Cruz.
Hi, thanks, Bill. So I've noticed, I've done a lot of walking around town. And by the way, sorry I'm late to the meeting. Yeah, something came up. But in walking around town, I've seen some good adherence to the governor's orders, and that would be Little League. But I've also seen some, poor adherence to governor's phase 3 guidelines. And my walking goes along Elm Street. So, that would include, some basketball and also softball, both young league and adult league. So Heather, has there been any exposure to COVID with the adult leagues? Hello?
Not that I have seen.
Okay. All right. Thank you.
Sure, thank you.
Conaby.
Yes, on that, getting back to the hockey, are most of the cases you're seeing the youth leagues or the adult leagues?
They're the youth leagues. I
Okay.
haven't had anything from the adult leagues.
Yeah, I'm wondering, especially in hockey where the kids are sitting on the bench part of the time, if that would constitute the whole team being within being a close contact because of the time. But the question is, most of these cases are, you're saying travel league type teams where there are kids from multiple towns, and that's where the issue is coming up with the reporting?
Correct.
Yeah. Now, a lot of the rinks aren't in Acton, but is there any way that you can get some of those kids that are on there, because they're probably playing school sports as well, to have a mandatory reporting?
So I've reached out to the state to see if there's any way we can have, some kind of guidance for these leagues on reporting. As far as I know, and Cheryl, correct me if I'm wrong, I do not believe the school is doing any type of hockey. Is that correct, Cheryl?
Yeah, I'm not aware that they are, but I'm not 100% either.
Is there any way for the operators, obviously rinks or, a business, to have a list of those attendees so you would be able to trace it quicker within that town? So you could note if the person was skating in, I'll say Boxborough, for instance, that they would be able, if they had a positive case, you could go to the operator to get that information instead of chasing it down from the league.
I'm not sure if they're doing that, to be honest with you, but that's a really good idea. I just don't know if they're doing that.
Yeah.
And most of the leagues are outside the Acton Boxborough.
Yeah, I would expect a lot of the travel teams travel far and wide, even outside the state. But if you could, at least a lot of them would have practices here, so you'd be able to get that information in a more timely manner. But
Possibly.
yeah, I'm not really sure what else you could
Yeah.
request. A lot of these leagues do have, good email lists between the teammates and things. So hopefully some sharing of information could be forthcoming to help prevent the spread.
Sure. No, we just wanted to mention it, knowing that you all are asking, frequently about trends that we're seeing, and that's definitely one trend that has been a challenge the last few weeks.
We cycle back to the assisted living and the nursing home. How are they doing?
I reached out to them last week, and I have been out straight since Thursday, and I apologize. I haven't been able to get in touch with them I've been playing phone tag. As far as I know, there are no issues as of yet, but I will follow up with them later in the week.
Yeah, it'd be good to do. I mean, I think they're doing more routine testing of all the staff and residents. Is that correct at this point?
That's my understanding of Life Care of Acton. I believe they've been doing that since this all started. That was their plan. The assisted living, I don't know if they're still routinely doing testing. They were having the National Guard do the testing when there was the issue with assisted livings and long-term care facilities. I don't know if that continued, to be honest, but I will definitely touch base. Like I said, I've just been playing phone tag all week. Well,
Yeah.
it's Monday, but my week hasn't really ended. So
Understood. But the other
Sorry.
thing is some of the group homes and group living facilities testing, DDS and other ones have different requirements. You may want to check
Thank
on
you.
the results of those, make sure that those are being implemented in town.
Absolutely.
And last but not least, how did the flu clinic go today?
Oh, good. It went really well. Thank you. We did a clinic. Thanks for mentioning that. We did a clinic at 30 Sudbury Road. We actually did a senior clinic today and Friday. And we're actually doing it in the dining room with limited nurses, two nurses doing the injections and one person checking people in. People are registering online, which is great. For having that pre-registration done, but it is a lot of extra footwork, if you will, to get to the point of the clinic itself. But no, it went beautifully. People checked in at the desk, had their appointment, their paperwork was all filled out on the website. All they had to do was, if they couldn't upload their insurance card on the computer, we have a scanner now that does that the IT department purchased for us. So it went really well. And we are just finalizing the date for our drive-through clinic. And that should be posted and up sometime this week.
When do you anticipate that being?
The tentative date right now is November 7th at the DPW department. We've determined that based on the pre-scheduling that we're not going to do that for the drive-through. We're going to run it as we've done the pandemic planning that we did 10 years ago. We're going to run it the same way.
Thanks. Thank you for the
Sure.
update.
Thank you for mentioning that. I appreciate that. I forgot to say anything.
Okay, well, thank
Heather,
you.
is the vaccine that you're giving, the senior vaccine?
We do have a limited number of high-dose vaccine. Yep, that was the clinic we had today and the same on Friday.
Okay, thanks.
Sure.
Well, Heather, thank you again for your update and for all the work you do. I mean, I guess I'll just express probably the board's frustration, which is, you're right. We did want to know about, clusters and tracing and tracking. I guess trends, that's the word. I knew it was a T word that I was struggling for. And, because we'd like to be able to try to stop them. And, you've given us a conundrum that it sounds like there is no easy solution. But if there is something that the board can do using our, ability to pass regulations or requirements or orders or whatever, then I believe the board is certainly would like to hear about that. So if something comes to mind, please let us know.
Thank you. I appreciate the help.
And other than that, any other members of the board have questions or comments? Okay, seeing none. Cheryl, any members of the public have questions or comments for?
Think so. Hold on. Somehow I just lost my, no.
All right, very good. Well, in that case, then let's turn our attention to the next item on the agenda. And thank you again, Heather, which is at 514 Main Street. It seems we're having a little issue with the septic system there.
Right. So we have been going out to that site, or we've been getting notification from the tenant, and there was a bit of an issue with some communication between us and the owner. So that's why you see the fine letter that we included in your packet. But I guess what's happening is, for some reason, if you have a Verizon, AOL, or Yahoo email, our emails are going to people's filters. So this isn't the only time we've heard this. We've reached out to IT, who's put in a request with Verizon, but pretty much they told us just to tell people to check their filters. So there's really not a lot we can do. So that was a bit of the problem. So Evan was actually out there today with David Chandler from Sewer Works, and they actually were able to camera the lines today. So just for a little background, they came before you. It's a fairly newer septic system that was bubbling up on the ground. This is maybe about 2 months ago, I think, that we brought it before you for the first time, and you guys gave them extension. They put in water saving toilets. They've asked the tenants to minimize the use of their water. They fixed a leaky shower, I think it was. So they put some effort in and to try to get the water use down, but they're still using, I didn't write the number down. I think it's 392 gallons of water per day, which is still significantly high. So anyways, they're still having problems. They're still bubbling up on the ground. So today, Evan went out, they opened up the D box, they introduced water to the D box, and it took about 15 to 20 seconds before it started bubbling up on the ground. So after Evan left, they were able to get somebody over there with a camera, and they were able to, they unsuccessfully couldn't get the camera down the line. So the installer stuck his hand down the chamber, and it pretty much came out with sand. So these are Cultec C4 chambers. They have been known to settle, but what they're thinking now is that the chambers are full of sand. So they've settled, and there's only one chamber that's effectively working. So I do have both the owner and the installer. I think he's just shown as David on my participant list, but I do have them both here to maybe talk a little bit further about this. But given what the camera showed today, it's our recommendation that we allow them to pull up the chambers, replace it with clean sand, and then we want them to lay a geogrid down. So what a geogrid is just kind of like a thing that prevents the chambers from settling. So it's just like a mat that goes on the ground with holes in it, and then it prevents the chambers from going down into the sand. So ultimately they still work, and then reinstalling the chambers. So that's what we're thinking, but I think it would be helpful for you to hear from the others as well.
Okay, sure. Please, I guess maybe it would make, as you said, the both the engineer and the owner is available.
Yeah, so I think, David, I'm going to allow you to talk. I'm pretty sure that you're David Chandler, but if you're not, just indicate that when you start talking. You should be able to go ahead, David.
He's still showing as muted on my screen, Cheryl.
Yeah, you need to unmute yourself, David.
Can you hear me?
Yep.
Okay, I'm never done this before. How do I look?
Well,
You
we
look
can't
like
see
David.
you.
Okay, thanks. Anyway, Cheryl pretty much expressed what we found out there today. Just one little minor correction is that the pumps that feed up to the leach field, they did fire automatically from use out of the building. It didn't come up on the ground, but it filled up the hole on top of the D box. It didn't make it all the way out of the ground, but that's what I saw. Who knows what we're going to see tomorrow. But yeah, one of the problems there is an excessive amount of water being used. I've got the water records from the last 2 years, and they're up around 400 gallons a day. And we did poke around. These cul-de-sacs, yep, sometimes they do settle. I've never had it done before, settle before, but I guess they do. I was wondering if maybe they were, I don't know, sometimes they can be crushed. But the ones that were installed were H20 rated so that they could be driven over. So I can't think of them being, I don't believe that they were crushed in any way. So the only theory we have right now is that they settled. That's the only thing we can come up with. We haven't found any other type of smoking gun. Whoops. You see me?
Nope. We lost Cheryl's video.
I'm back.
Who's back?
Okay.
She probably just needed to sneeze. Could I?
So the
ask-
only theory we have is that, they settled. We haven't really found any smoking gun, is to say, yep, here's the problem. But to find out if they're settled, the only way to do that is, well, you basically have to dig them up.
So can I ask, is this a 3 or 4 bedroom residence?
I believe it's a 4.
So that it would be designed for 440 gallons a day, correct?
Correct.
So when you say it's using 400 gallons a day, that should be within the design flow.
No. Cheryl, you can
No.
explain that better than I.
So when you design 440, you're expecting them to use about half, so about 220 gallons per day.
But I thought there was conservatism built into the 440. So
The conservative, it should be around 220, and then there is some, increase to go up to that 440. But I
There's a
mean,
peak.
it could just be the settled. It could be the amount of water. Like you said, we don't know for sure, but we do know we have seen others that have settled as well. They're just, honestly, they shouldn't be approved without some kind of geogrid underneath them.
okay, well, very good. Well,
Just Cheryl, just another thought was, I never heard of the geogrid put under them. Evan had mentioned that. If you allow us to pull them up, would say a 3-inch layer of crushed stone under them, would that work just as well as a geogrid?
I don't know. I know Evan's
All right.
recommendation is GeoGrid, David.
Okay, that's fine. No problem.
okay.
Thought I'd ask.
Well, I'm sure, there are other solutions that could be engineered and that, but the first step, as you say, is to determine what's wrong. But could I ask, you also mentioned that the owners are available online. I'd be interested in hearing if they're, committed to this, following through on this course of action, if this is acceptable to them.
Sure, I'll allow them to talk right now. Okay, you should be able to talk. You need to unmute yourself. Rue? You need to click your microphone in the bottom of the corner and
Or
it's
press
on the
down,
bottom left of just click on the mute button and it should unmute you.
or hold your space bar down if you're on a computer.
Yeah, I don't think I can unmute them.
Oh, yeah, okay. Now it's okay now.
Yep.
Yes.
And first, thank you, Sherry, for the summary. Yeah, my name is Wei, my wife Ru.
You can,
Yeah,
you can see us.
Yeah. So when the problem came out, we got the David for the inspection. We found that the problem most likely it is due to the over use of the water. Actually, we checked the record in February. It was more than 600 gallons per day. And then it's changed to 500, more than 500. Then when we found the problem, it was above 400. So we immediately asked the tenants reduce the water usage, and we changed water saving toilets and also water saving washers. We bought 2 actually. Then also we obeyed the order from your department and pumped the septic tank. They immediately, and then followed by another one. Then after that, from the water, or also they reduced the water use. And after that, our manager took the picture, said there is no water on the ground. That's why we did not continue to pump. But we did give the monthly report with a photo attached together to your department. And unfortunately, yeah, we never got the email Evan sent multiple times. Then when we just send another email, then Evan realized we probably did not notify. That's why I think it caused the fine. That's why we'd like to petition for the waive of the fine, because we were actively managing the problem and tried to solve the problem. Today we were also on site to see what's the problem. David explained something, so we hope he can fix the malfunction part, and because it's relatively new. So
Mr. Liu, may I just ask, so you're in agreement with having David try to determine the fault of the system and then have it fixed? Is that what I understand?
Yes, we agree. Yeah.
Okay.
I think that's the best interest for everyone. And it can be, if it can be fixed in several days, that's better.
So I think that's the department's recommendation as well. So
also because of we give some time to the system after water reduced. And so I think it will take a while to let the land recover. That's why we need, I think, extension of the time to fix the problem. It will be, I think the due date will be 28th of October. May we have more time to let David work to complete it? Yeah, the
okay.
job.
So Cheryl, what would you need from the board? Is there an extension required? And
so, I'm a little hesitant to give them an extension because it is blowing on the ground. It's not a safe environment, but I would be, willing to waive the fines. The fines were put in place because we thought they were unresponsive. And then the other part is I think we need a plan of action by the 28th. What you're going to do. I know it takes time to order parts and people have schedules. So I would say maybe mid-November, but I would want a plan by October 28th.
so do you need the board to take any action to? Okay.
Yeah, can I talk?
Sure. Who is
yeah,
speaking?
This is Ru.
Oh.
This is Ru. For the extension, we also, besides we just talked, we talked to the planner also. Because you suggest to us to talk to the designer, and they said everything takes a longer time. And only get the permission is take a couple of weeks. So, the whole process takes a longer time because it's the 10 days. I don't think
I think Cheryl is acknowledging that it could take longer. What she really wants to see is that you're making progress, right?
I think it's up to David. We'd like the job done as soon as possible. If David, as David said, if we can finish in 3 to 4 days, that's the best. But if he needs some parts, let's say some work need a longer time, I think it's better we get some extension.
Yeah.
But if we don't need that time, that's better. But
Okay.
if we need that time, we can avoid
Yeah.
another fine for that.
Excellent.
Because
Yeah.
we can't control the time. If it is as us, we like it to it's done as early as possible. But sometimes we really can't control the time frame.
I don't think anyone wants to hold you responsible or punish you for things you can't control. But if I may, at this moment, I'm going to try to speak to members of the board. So if I could just ask you to hold off for just a second. Members of the board, what I understand from Cheryl is that actually this doesn't require any board action, but I believe the health department would like our opinion as to whether or not we think this is an acceptable approach. Did I phrase that correctly, Cheryl?
Yeah, I mean, we don't usually allow people to dig up their leaching field and do this kind of extensive work. So I would definitely be looking for the board's approval on that.
Okay, so members, questions, comments, concerns? Ms. Becerra.
Hi, Bill. I'd be okay with this, but I am concerned about the high water use. I'm glad that it's gone down, but it still seems like a lot for a house of that size to have, 400 gallons a day, every day. It's not just, a seasonal thing. So and I'm glad that the owners put in low flow fixtures, but I'm wondering if there's are there leaks in the house that they don't know about? I'd like to sort of have them investigate that a bit more, because, are they going to be back in 5 years with, another situation because of the high water use?
Yeah, we specifically asked the professionals to rule out any leakage. And seems now there is no leakage. The water use now is cutting to 360 gallons per day in the last month. They are making some progress, but I think that they will not live there for that long. We'll try to change the tenant, whenever the lease is ended.
Okay. Other members, Mr. Conaby.
Yeah, how old is the system right now, Cheryl?
I don't have the age in front of me, but it's like 5 years, I think.
Okay. And has it had a history of being pumped during that 5 years?
Oh yeah, because this house was pumped every year, right?
Before this tenant is like more than a year, but this tenant, because they used more water, so we pumped. I checked our record. It's like 8 months. Every year.
Okay.
I gave the record to the board of
That's
the
fine.
house.
I was concerned about clogging. I mean, obviously, if a system is collapsed, it's not going to take very limited water. And that's whether you have 200, 300, 400 gallons are going to have breakout. So I guess the question comes back on the call tech. I would probably suggest you contact the manufacturer of those, have the engineer do that, and find out what they would recommend if this as a remedial repair. And it may also be worth checking with the approval from DEP to see if they have any recommendations on this as well. But as far as, if it's this young and it has been serviced, it does seem.
It's a 212. That should be 8 years.
8 years, yeah.
8 years, yeah.
Yeah.
Well, it's not that old, but thank you. I mean, so I guess the point is, I would say it's fine if you want to do it as a emergency repair, as long as you have the full permits, the inspections. And I would suggest that when they get done, that they scope the lines to make sure that they're all open and do a hydraulic water test, and then do as-built plans to the department. So we have some basis and record going forward if there's a problem.
Yeah, and part of it, Mark, and I'm sure you caught the point, is this is actually sort of an investigation at this point. I mean, there's a supposition as to what the failure is, but I guess they need to go determine what the failure is.
Right, and part of it's going to be, digging it up to see, but part of what you're going to see when you dig it up is that you made a mess and you can't see what happened. So it's a conundrum.
Indeed. Dr. Bill, I saw you unmute. Did you have a comment or are you all set?
Well, reading the letters, it said there was some pumping required that wasn't done in the acute phase of this. Would that be helpful to continue pumping?
So, yeah, and they've been told that anytime it starts bubbling on the ground, that it requires an immediate pumping. I think a bit of that issue, Dr. Bill, was the not receiving the emails. But I think, as owners, I think they definitely need to watch that and get it pumped if it were to blow onto the ground again.
Okay, thank you.
Cycling back, I think you can waive the fines, but I think you should do that upon completion of the repairs in the situation rather than immediately, to make sure that things progress appropriately.
Okay.
So I think that sounds like the board's consensus. You don't need us to approve a petition, from what I understand. So it sounds like the board's consensus is please continue and please keep us informed.
The installer has raised his hands again. Do you mind if I let him talk for a minute?
Sure.
David, unmute yourself and you can go ahead and talk.
Yep. Can you hear me?
Yep.
Yeah. I talked with one of the tenants today. He come out when I was playing around there. And, there's 7 people living in the house, but he's under the impression that there's 7 people that he can use 50 gallons a day for each person for 350. And I did tell him, you can't do that. You should be down around 200 gallons. Tell you the truth, my suspicion is there's something going on there that's using all this water. And, they've done their stuff they've had plumbers in for leaks, and they've, supposedly there's no leaks, and they did low flow toilets, and we're still getting the high volume. I honestly don't think 7 people are using 350 gallons. There's something else going on. That's my opinion.
Okay. Well, thank you. I think we have a consensus, and I'll say a conclusion for the moment, which is, there's a plan. As long as the plan gets followed through, we'll hopefully come to a successful conclusion and we can put this matter to rest.
Okay.
If we are not successful, if, we hit a problem when, parties aren't willing to move forward, then I guess the board will have to get involved again. So, okay, well, members or Cheryl, if there's no further discussion, I believe we can actually move to the next agenda item.
I'm good.
Okay, I don't see any members unmuting, so I'm going to assume that they're good too. And to the property owners and Mr. Chandler, thank you for your participation. We appreciate you giving us the background.
No problem.
All right, well, I'm going to move on to our next agenda item, which is revisions to Article 9 and a discussion. I saw the thing you sent, Cheryl, and if you said the changes were in red, there was only one paragraph that was just added, basically. So it's a very straightforward.
Right, and I think as I mentioned last time, these items in red are typical regulations that we put on all the other geothermal wells that have been before you. So it should be pretty. I mean, again, this has to go to public hearing, so tonight would just be discussion.
Well, great. So I'll just offer one comment, and it finally clicked to the top of my brain as to what it was that was bothering me last time about this, and that's that all of our well regulations are focused on the idea that you were withdrawing something from the ground, and it doesn't really ever go back. It makes its way somewhere, but it doesn't necessarily go back to where it came from. But that's not the one exception is a geothermal well, where you're actually pumping things into the well. And I know we address that by trying to make sure that it's stainless steel pipes, and it uses propylene glycol, as a transfer medium. And I'm just wondering if some of that, if there should be a way to add to the geothermal regulation that, any working fluids or whatever must be, non-toxic, or there must be some sort of leak or um, just something along the lines to, it's, similar to the insulate situation where they're actually putting water into a well. This would be something other than water, which is potentially slightly more, or potential for more harm.
Bill?
Yeah, Mark.
Two quick things. One, why don't we just have the day be closed loop wells, so therefore there's no re-injection allowed of anything. Problem solved.
Okay.
I mean, there are some folks who would use the water and pull it out and use it through a heat exchanger and then re-inject it back into the well. But as we've learned, the re-injection back into the wells can be very problematic. So I would suggest that you have that they be closed loop systems. And then, as you said, there would be no water for re-injection without a separate permit. The only other thing I was going to mention, but I think it was starting to allude to at the last meeting, we have the title of Article 9. I think it probably ought to be, minimum standards for wells and private semi-public water supplies. So people would know that when they read the title, that there's actually a well regulation. It's not just private and semi-public water supply. It would be more helpful for folks if they're looking at it, especially as we go to public hearing.
I can do that. I missed that at the last meeting. I'm sorry.
No problem. You got a lot going on, Cheryl. It was just one of those things that I just was thinking about. I should have mentioned it earlier.
Okay. Thank you, Mark. Other members, comments on the proposed changes to Article 9? Ms.
Nope,
Becerra.
they look good to me. Yeah, no.
Okay.
I think.
Thank you. Anyone else? All right. Well then,
Bill, what are the next steps with this?
schedule a public hearing, discuss it, accept public comment, and if the board so chooses, vote them as the new amended language for Article 9.
Well, yes, but I guess what I'm asking is when would the planned public hearing be?
Some convenient date in the future.
I have to advertise
Okay.
for at least two weeks. So, I mean, it probably wouldn't be the next meeting, but the meeting after that.
Okay. Other questions or comments from members? If there's none, I'd propose then we move to the next agenda item, which is the minutes of October 5th. At least I hope so, because that's the ones I have in front of me.
Yes.
I did read them and they look very good. I had a couple small comments, mostly just for clarity, not for correction. And yeah, they're so in the paragraph, it says under regular business, the very last paragraph on the first page, it just says Ms. Ball stated that the face covering complaint was conducted, and I was just going to add the word investigation, just so it's, and then this is a really odd one, but on the next page, third paragraph, it says Ms. Ball stated that Acton is a green community. And I guess I just was going to suggest a clarification that it's a COVID green or green according to the state map, or
Yeah, COVID shaded green, probably it should have said. So
yeah, just because a green community just sometimes has a different meaning to people. And then this one, Mr. Cruz, I know you missed the meeting, but under athletic fields on the third page, I made the proposal that the person who's using the field be responsible for meeting the COVID requirements. And the board, I believe, so the problem is the paragraph ends without saying what the action is. And I believe the board was okay with that, although given that you're on the phone, would you like to speak to that and then what your opinion is?
Yeah, I think there are different types of users. There are community users that are like Acton Softball League. There's like youth, neighborhood kids that show up and just play on the fields. I don't think we should be slamming them, but definitely the organized leagues like Acton Softball and commercial operations that use fields for their professional, like not enjoyment, but their professional benefit, should be held to the governor's phase 3 guidelines. And I think they should be accountable and responsible for that.
Okay. I believe that was the board's consensus at the meeting that these minutes are for. So I would just suggest that we add to the minutes that, the action was to, I guess it's the recreation department that gives the permits for use of the fields. We should ask. Please go ahead, Cheryl.
So I've already done that. I reached out to both Community Ed, who manages the school fields, and the rec department, and they've agreed to send any application my way for a little check with the guidelines that I'm going to send them. So you're right, Bill. I should have said, I'm pretty sure you guys said at the meeting to bring it down to, that I would take care of it. I might be wrong on that, but you're right. You guys did agree to it, and I've already followed through, and the process is already ongoing.
Okay, very good. And yes, it's my recollection that we agreed to it as well. So we ought to just put that in the minutes. Is what I'm suggesting.
Okay.
And that's Mr. Conaby.
Yeah, I thought that we had said that we were going to try to put a little bit of enforcement to make sure that the permits were conditioned on compliance with the COVID conditions. So if they did not comply, that the permits could be revoked. That was my recollection. And I didn't see that in the minutes. I was just going to, maybe we just add that back in. I had one other correction, getting back to the Spruce Street Aquifer Special Permit. We made a motion to grant the permit with conditions as amended, not just the floor drains. I think we need to because there were a whole set of conditions. So I guess I would just make sure we be consistent on that. They were amended, but we approved the permit with conditions as amended, and wasn't just the floor drains. We recommended we did have the department approve them, but we were trying to make sure that certain ones went to tight tanks and they used indirect race rather than floor drains whenever feasible. But I think that was delegated to the department, but I want to make sure the motion was clear that it was with conditions amended.
Good catch. Good. Thank you.
Thank you. Other comments or corrections from members? I'm not seeing anyone press their unmute button. So if these are satisfactory to the members, the normal process would be somebody makes a motion.
I wasn't there, but do you want a motion, Bill?
Well, typically if I was really desperate, I'd say yes, but I'm gonna I'm gonna suggest that one of the members who was actually at the meeting should make the motion. Ms. Becerra, I see you've unmuted.
I move we accept the minutes with the additions and comments as noted.
Thank you. Is there a second?
I'll do the second with corrections.
Very good. Thank you, Mr. Conaby. Motion is made and seconded to accept the minutes with corrections, updates, and comments as noted. All those in favor, please say aye.
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 I think I heard everyone. Dr. Taylor, I did not hear you.
Aye.
Thank you. And then I'll just make sure I got everyone by saying, are there any nays? Okay, hearing none, I declare the motion passes unanimously. Thank you very much. I believe that now brings us down to the bottom of tonight's agenda, which is just as Cheryl, any other operational issues or concerns, or have we concluded?
I think I touched on everything that I needed to chat about.
Well, once again, I think we've managed to navigate the rocky shoals of the health issues, and particularly those in the pandemic. So thank you, everyone. And thank you, Cheryl, and please thank Heather for us as well. It sounds like, unfortunately, we're about to get challenged again, and that's not going to be fun. So, Ms. Becerra, I see you've unmuted. Are you about to make a motion?
I move we adjourn.
Very good. Is there a second? Come on, Dr. Taylor. I can see you want to.
I second it.
Thank you. Motion is made and seconded that we adjourn. All those in favor of adjourning, please say aye.
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 Any nays? Thank you all. The meeting is adjourned.
Thank
And
you. Good night,
I should
guys.
ask Cheryl, when is our next meeting? That is one thing I forgot to ask.
You know what? I forgot to look too. I think it's November 2nd. Let me just look at the calendar here. Yep, November 2nd.
All right. Well, thank you all again. Good night. Talk to you November 2nd.
Good night.
Night.
Good night.
Night.